you're largely going to hear from us today is that vaccines work. They're safe, they're effective, they really make all the difference. Unvaccinated people, they comprise 98.5% of all cases. Further, 97.5% of all hospitalizations in the past 6 months plus, and 99.2% of deaths have occurred in unvaccinated individuals.
For whatever it's worth, I am a very skeptical person and not a typical vaccine advocate. In both my professional and personal life, I am highly distrustful of everything our government does. I got my first vaccine shot on March 17th, and my second COVID vaccine shot on April 14th. Be not mistaken. Getting a vaccine is not an endorsement of any policy decision or thing that our local, state, or federal government has done during this pandemic. Getting a vaccine is not a political decision. It is a medical decision. We've lost leaders in our agriculture community to this disease.
So I do encourage minority members of the population to consider that we are more prone to chronic diseases such as high blood pressure, diabetes, atherosclerosis, effects from smoking that make us more susceptible to COVID-19. So I do encourage you to consider to make a decision for your health and for those that you love, and to use common sense when you're out, that the vaccine is available and can be helpful, but COVID-19 is not going away.
And my message today is really to those parents who are hesitant about this. Please, I just beg you, please get your teens vaccinated. Thankfully, we recognize that is not a population that has high risk, but they do spread it, and there are complications that occur in teenagers, that missed inflammatory syndrome that they talk about. That's not some sort, I've seen that. And you don't know which child, which kid, who's going to be that person. And so I don't want to take that chance. And I speak often to people who are hesitant, and I get you. I get your concerns and your fears. But I'll tell you, COVID is not some obscure disease of 100 years ago that we have the luxury of debating whether we want to get the vaccine or not. This is an epidemic and a crisis that's occurring now.